So my name is Emily Hoffer, and today I'm going to be presenting on my research for mental health, substance abuse, and suicide. These topics have a very negative stigma surrounding them, and it's a very complex and prevalent issue in today's society. From the research that I did, I found that we need to focus on understanding mental health to decrease the stigma and change the way that those who suffer are viewed. Mental illness can occur in anyone regardless of their background, social standing, or ethnicity. And we can do this by educating on mental illness, treatments, and options that are available, and this in turn can decrease chances of suicide. So I'm going to start by talking a little bit about depression. So depression is one of the largest problems in today's society. According to the Association of Anxiety and Depression, MDD is the leading cause of disability in Americans aged 15 to 44, and over 16 million people in the United States are affected regardless of their ethnicity, background, or social class. The criteria for having depressive disorder is a depressed mood most of the day, nearly every day, suicidal ideations, diminished pleasure in activities, feelings of worthlessness and or hopelessness, inability to concentrate, change in appetite, and fatigue. And a lot of times people view people with depression as like lazy and unmotivated, and it's a very negative stigma that can surround depressive disorder. And the term has become very normalized and mainstreamed as well. People will say like, I'm so depressed today, when in reality maybe they're having a bad day or things just aren't going well. So the term, like I said, has become very mainstreamed. But the treatments that are typically seen with major depressive disorder are therapy, antidepressant medications, and ECT. And then the next disorder I'm going to talk about is bipolar disorder or manic depression. So this consists of both manic and depressive mood states that can severely impact functioning and can cause impulsive behaviors. According to the National Alliance on Mental Illness, this disorder affects approximately 2.6% of the population, and the average onset is 25 years old. So the criteria for having this disorder is the occurrence of one or more manic or mixed episodes, feelings of grandiosity, decreased need for sleep, pressured speech, excess pleasure, other impairments that are not due to substances or a medical condition. And then again, this can also be very stigmatized. It's a normalized term, and people use it to describe everyday mood swings. So be like, oh my gosh, my professor was so bipolar today, and things like that, when in reality this is a real disorder that a lot of people suffer from, and it's not really something that should be joked about. And then treatment options for bipolar disorder include mood stabilizers and cognitive behavioral therapy. So next is substance abuse. Substance abuse often occurs because individuals will seek to numb themselves, whether it's from another mental health disorder or just something negative that's going on in their lives, and it's often a vicious cycle. Substances can reroute your brain, so you can have a depressive episode, and so you look to drugs and alcohol, and that in turn just makes you more depressed or causes an even poorer attitude or addiction, and so it just continues to repeat itself. But substance abuse can lead to organ failure, infections, cirrhosis, and countless other health problems. We would be here all day if I listed them. And addiction is an actual disorder. Like I said, substances can reroute your brain. And it's tied in very closely with mental illness, because if somebody is already impulsive, then they probably don't have the motivation to care about what happens to them. So they'll turn to drugs and alcohol to either numb themselves or stimulate something within themselves using the drugs. So again, it can be a vicious cycle. And then suicide. Suicide is the process of intentionally ending one's life. It can occur with any mental illness. There are different levels of lethality. There are more attempts seen with women, but more lethal measures are often used with men. And the reasons or types are egotistical, altruistic, anomic, and fatalistic. And it's also important to remember that suicide is always preventable. So dual disorders and suicide is the first article that I'm going to be talking about. It's by Abrams and Scher and was written in 2016. This study focused more on planning and preventing rather than the actual studies, which kind of limited the research. But it did find that suicide is one of the leading causes of death, and 90% of the people who attempted suicide have mental health disorders. And those diagnosed with a mental illness and substance abuse are over twice as likely to attempt suicide than those who are not. The medical data and trends found that one study achieved improved abstinence, delayed drinking, and lower depression in patients treated with sertraline and naltrexone compared to monotherapy. So using more than one medication to treat more than one problem that you're having, rather than just taking an antidepressant to treat your depression, you're also taking a medication that helps with the addiction that you're facing. And that, like the quote said, did improve abstinence. And then it also hypothesized that treating all disorders as equally important would increase patient outcomes. So that again is related to what I just said, treating the substance abuse and the depression rather than just focusing on one or the other. And you can do this by pharmacotherapy with medications, psychotherapy, whether it's group therapy or one-on-one, and then 12-step programs can also be useful. And this helps with treating patients holistically rather than just having one view of them. And then factors affecting mental health. Self-esteem can be a huge factor in one's mental health. You have to look at how an individual looks at themselves and how others look at an individual. Social media can affect mental health, education, and then the resources that are available to those individuals. So some schools, for example, Mount Union, we offer counseling free to the students, but that's not something that's seen at every college across America. So mental health could be better here than it is there. I haven't done the research to see it, but just an example of how resources could affect someone's mental health. And then where do we go from here? So early education is important. Educating in schools early on in health classes instead of focusing on just main things in health classes, reaching out and focusing on mental health as well. Counselors in high school, having those resources available throughout high school, colleges, and in the workplace, because mental health is a lifelong disorder, and it's something that some people struggle with their entire lives. So having counselors in high school, making it easier to get appointments in college, sometimes because mental health can be such a big focus in college-age students, it can be hard to actually get in to have that meeting. Talking about it more, just in general, a lot of people are just afraid to speak out about mental health, and so just talking about it more to decrease that stigma and make it more normalized, like it's okay. A lot of people struggle with issues like this. And then in the workplace, having counselors and resources to get help if needed. Some workplaces don't allow time off for counseling, rehab, things like that, and it is something a lot of people struggle with, as I said. And then recognizing signs and symptoms, so look for personality changes in your friends and family. If they all of a sudden have low motivation, if they talk about feeling hopeless, if they begin to pull away and isolate themselves, those are things that we need to be paying more attention to rather than just brushing them off. But the main focus is prevention and preventing suicide and mental health from progressing, and just focusing on talking about it more, decreasing that stigma that is associated and that we see nowadays. And then these are my references.